Welcome to 32 Questions, 4 quadrants of questions, where we talk about, it's a video series where we talk about and ask questions highlighting different dental specialties, but also the journey into dentistry, so that you all can gain insight as to life as a practicing dentist, as a practicing specialist, as an advocate, as an academician, all those things that lead to us providing oral health care for the public. So today we're joined with a special guest, and we're just going to dive in with the focus on dental public health today. Dental public health, why oral health and dental public health matters so much, not only to the dental profession, but also to medicine as well. So let's get started, special guest. Please share your name and where you're from.
Hey, I'm Dr. Elizabeth Powell, and I am originally from Dallas, Texas. But I am a recent transplant from Boston to Philadelphia. And let's see, my journey into dentistry was probably a little bit non-traditional. I started out after going to undergrad at a smaller HBCU in Huntsville, Alabama, Oakwood University. Um, After completing that journey, I got my master's in public health from George Washington University in Washington, D.C. And I worked for the Department of Health for about 3 years before deciding to go to dental school. I had a really good friend who was in dental school at Howard at the time, and he kept saying to me, listen, there's a need for more women dentists. There's a need for dentists who are interested in public health, and I see that you're doing that already. I think this is something you would be great at. And I took his advice and I applied to dental school, and I ended up going to NYU. I had a great experience there. And from NYU, I did my GPR at Bronx Lebanon Hospital Center up in Harlem. I'm sorry, up in the Bronx. And just just that was an amazing experience. Also because Bronx Leb has this balanced hospital-based program that is also embedded in community health centers. So that was perfect for me because I got the opportunity to work in the or rotate through the community clinics. About I'm going to say for 50% of my rotations, and the others were in the hospital. So that was a great experience as well. And then from there, I ended up working in federally qualified health centers for the majority of my career. If you've been to one community health center, you've been to one community health center because they're all different. But I spent some time at a community health center in upstate New York for about 4 years, and then on to DC. And then I ended up landing in Boston as the dental director for Codman Square Health Center, which is in Dorchester, Massachusetts, which is just outside of Boston. And had the opportunity to work with some amazing people there, do some amazing work. And while I was there, um, we also had students who were rotating through the practice from Tufts and BU Dental School, as well as a partnership with the NYU Langone program. So we have AEGD residents who are rotating with us as well. And, having the opportunity to kind of teach students clinically, and partner with individuals kind of in the academic arena, um, continue to just drive my interest in teaching, as well as, continuing to see patients. And while I was there, I was seeing a lot of pediatric patients. And much to my chagrin, my skill set stopped at a certain point. And so I had to make the decision to go back to school. And when I did that, I kind of uh, kind of fell into a situation that ended up being, it was a beautiful gift at the end of the day. what happened was I applied to Boston University's pediatric dental program. The chair of the department at the time said to me, you have all this great public health experience. We have a dual program in dental public health and pediatric dentistry. Why don't you apply to that program? And you can have the best of both worlds. You continue to practice as a general dentist under the auspices of public health dentistry, and add the pediatric dentistry specialty to your to what you're going to be doing for patients. And I said, well, that sounds perfect for me. And so we did that, and it kind of led me to kind of where I am here today. So that's kind of my story in a nutshell.
That's a big nutshell, because yeah, I mean, that's a big nutshell, because you really have encompassed over a decade of training, a decade of a lot of hard work, a decade of moving around different parts of the country as well. So it's a lot. So that's a great summary. And it's a summary that has pieces that I want to share a little bit more about, because not everyone is going to have a journey similar. Their journey is going to be different, but their journey also may be connected. There may be some pieces and opportunities where there's some connection with how they get into dentistry, and then how they are contributing to dentistry, either on the public health side, policy side, or even on the academic side as well, right? So let's back up a little bit as it relates to dental school, because based on your story, your introduction to dental school then happened after already getting a master's in public health, right?
Yeah.
And then you went to NYU and transitioned from public health overall into more of a specialty area called dentistry, right? Oral health. Tell us a little bit about during that time in dental school. Was there a time where you knew what specialty that you were considering or wanted to explore, or was it not even on your radar at all? Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode.
So I would say when I first started dental school, specialty wasn't really on my radar. I spent a lot of time just trying to get acclimated to dental school. As you know, it's kind of like it's a cultural shock. You're trying to manage your time and the volume of material that's kind of being thrown at you. So I can't say that in the first 2 years that I was much focused on specialty. What I did always know though, I knew that I was never going to be in private practice. Coming from public health, um, my goal was to try to work in space where I felt like I could make a difference for the community. I've always seen the community as my patient, in addition to having, to being blessed enough to see patients individually. That's always kind of been at the background. So I will say this though, by the end of my third or fourth year, I was part of a great group called SNDA. And SNDA is known for doing a lot of community outreach. NYU has, really great roots in the community in Manhattan and in New York City. And so there were times where we would go out and provide oral health education in school-based settings. We worked with other SNDA chapters and other dental schools in the area to develop, I think, the first oral cancer walk that occurred I think that was in 2006, 2005 at NYU, and I believe Columbia was a part of that effort with us as well. So those kind of activities kind of allowed me to have a well-rounded experience at NYU. And then by the time, I kind of got to the end of third year, beginning of fourth year, I spent a lot of time in pediatric dentistry. So I kind of knew back then when I graduated in 2007 that pediatric dentistry was somehow going to be a part of what I was going to end up doing as well. But I felt like I needed to do a GPR and become a really well-rounded dentist, because I felt like if I'm a well-rounded dentist, that's going to make me an even better specialist. And that's something I didn't just come to on my own. It's something that I heard from my faculty consistently, because they were always saying, it's great that you guys want to jump into specialty, but let's make sure you really understand dentistry as a whole, because it will make you a better specialist. And so I went on to do that GPR from there.
Yeah. So it sounds like,
yeah.
Yeah.
So, I mean, just to answer your question, I mean, yeah, I kind of sort of knew, but it wasn't definitive. There were things that happened along the way that just kind of solidified, what I was kind of thinking I was going to end up doing in the end.
And I just want to highlight, you mentioned it was around D3 year that you really started having more of an interest in pedo, especially as it relates to your involvement with organizations at school that were in the community, that were out meeting families and individuals where they are, which is at home, not at home, but in school-based programs, and coming to them, not necessarily them coming to NYU, coming to the school as well. So D3 year, and I just wanted to star that because there are individuals that are listening and watching that may not know until D3 year that they may want to specialize, or they may want to not do private practice dentistry or be a general dentist, and that's okay. There are also going to be students that will know D1 year, first week, I want to be an oral surgeon, right? I want to be an orthodontist, and that's fine too.
Yeah.
Don't compare yourself to other people with regards to that, because your journey will be your journey, and that's it. So it's okay that you don't realize until D3 year, maybe some instances D4 year, right? The transition between D3 and 4 that you want to specialize. It's fine. It's okay. It's not the end of the world, end of the tooth fairy world. The tooth fairy is not going to be mad at you that you just figured it out, right? You do have some work to do in preparing for that journey into residency, into specialty. But when you decide and when you know, that's the time that you know, and that's unique for you. So I just wanted to share that because, again, some folks will know early on what they want to do, and some will continue their journey and explore the different disciplines. And when they find out is when they find out. Now, as part of that journey for you, was there a specialty that you knew definitely that you did not want to explore?
Perio.
Perio.
What?
Okay.
No. Perio. Even, the rotations, the requirements for it, I just was never, it, it was never something that interested in, that I had a lot of interest in, I should say. But God bless the periodontists who
Right.
are there for us.
Right. Right. Exactly. Exactly. Okay. So let's transition to the second quadrant here, which is more about your training and the uniqueness of your training, both um, as a board certified dental public health dentist and also as a board eligible pediatric dentist as well. So highlight for us the things that made one or two things that made you fall in love with dental public health also as a pediatric dentist.
Yeah, yeah. So a lot of that has to do with my work in federally qualified health centers. Um, because, like I said, I've always, because of my early public health training, that was not dentistry focused. Let's keep that in mind. That was just a master's in public health before dentistry. So it kind of had more of a global focus, even though I kind of specialized specifically in maternal and child health. So you can see certain things that were happening with me early on. Early on, I was interested in public health. Early on, I was interested in maternal and child health, which makes sense, as to why I am, doing what I am doing today. Um, in terms of, the training, um, and what it led to, I've always seen the community as my patient, so I'm thinking when I have a patient in my chair and I'm seeing certain things that are happening dentally, I'm wondering, well, what are the social determinants of health that are affecting this particular patient that are, it's lending itself to what I'm seeing dentally. And so, and when it comes to pediatric dentistry specifically, unfortunately, a lot of the children that I was seeing in health center settings, they come to us and the disease has already progressed beyond the point of just prevention. Now we're at the point where we actually have to provide, some treatment, and in some cases extensive treatment. Um, and so in my public health background, and I'm thinking about the caries rates for children ages 2 to 19 being, that total caries rate being 45%, you know, and that gels with what I'm seeing, from patient to patient, in the dental chair, and how much caries is actually prevalent, you know, in communities of color. I mean, untreated caries is higher among Hispanic groups of individuals as well as African American groups of individuals, and um, often that's what we're seeing, and so I think pediatric dentistry and dental public health have, you know, just kind of knowing what the need is has given me a desire to be in an environment where I can create programming to help address those needs that I'm seeing clinically. So yes, we have to do the individual work with the patient. That's critical as well, but also understanding that there's something bigger that's driving what we're seeing, and what are we going to do to address it, so that we start reducing some of these oral health differences that we're seeing between cultural groups.
Yeah, and that's key. And I like your focus and sounds like part of your passion, which is the community
Mm-hmm.
as the primary patient,
Yep.
right? The community as a primary patient, um, which I think at times gets lost in our dental school education.
Mm-hmm.
Um, we get to and we utilize and interact with individuals
Yes.
or groups of individuals from the community,
Mm-hmm.
And there is, for as patients, for requirements and for our progression and our training, and there are opportunities for students and even residents to continue to be impactful in the community where the school or where the programs are.
Yeah.
But unfortunately, sometimes it gets lost after dental school,
Mm-hmm.
after residency,
Mm-hmm.
to the point where maybe there's not as many that are involved with very impactful activities and initiatives that are within the community or that are in the people, for the people in the community, right?
Right. Right.
There's the business of dentistry
Mm-hmm.
versus the the uplifting of the individuals in the community using dentistry
Right.
or oral health. There's definitely a difference.
There's a disconnect between dental
Yeah,
service utilization and these oral health outcomes that we're seeing. Huge
right,
disconnect.
right,
We've
right,
done all this great work from a policy perspective. Every child, in just about every state that you go to is going to have dental coverage through Medicaid if that's what's needed, depending on the income bracket that their family falls into. But just because that service is available to them doesn't mean that it's being utilized. So what are we doing to connect patients who are at most risk to care? That's a whole nother ball game. But that's why I'm in it, right? To
right,
figure out the answers to these difficult questions.
right, right. Well, another question is related to your training and trying to understand a little bit, with that dual program and the training that you had prior to dental school with your MPH. What additional training is needed? Well, not necessarily training is needed. Let me go back. Through your training, did you have to do some specific research, or some like a specific fellowship track to get this perspective, this lens? To share a little bit about that part of both your doctor program in public health and also in your pediatric dentistry residency as well.
Okay, so not specifically any fellowships, at least not as part of my journey. Um, so, like I said, I'd kind of been in a community health center setting, partnering with the dental schools in my area, as a clinical instructor for both Tufts and BU dental schools, right? Um, and so one of the things that I think, and I know I'm going to get to the question about my training, but I just want to add this here. Um, One of the things that I think that is really fantastic about what some of the dental schools are doing now is this community service learning experience that is part of their didactic and clinical training, where the dental schools are intentional about having relationships with community health centers in the area and using them as pipelines for training for their students. And so what that looked like is me having D3 and D4 students rotate through our clinic for 6 to 12 weeks at a time, depending on, the school's preferences for that program. And I can't tell you how many students always were grateful for the experience. One, because they get a lot of patient care experience, and two, um, I can't tell you how many times students would say to me, I thought it was going to be different. It wasn't what I expected, working in a community health center, providing care. So that's one thing, with regards to the training, back to that. So there are research requirements for just about every specialty, I believe. Um, my focus, I think, for my dental public health residency, my main research project focused on food insecurity, and how sometimes, individuals or patients who are, suffering from or experiencing poverty, living in food deserts, and how that affects their oral health and all things of that nature. So that was, kind of my focus for dental public health. For pediatric dentistry, my research focus was on dental service utilization. Um, uh, you know, like I said, a lot of our patients that we serve have access to care, but they're not being able to be linked to that care. And what are we doing about it? So those are some of the research areas that I have participated in. And there's certainly dozens more. There's so much more to be discussed around policy, um, you know, how care is is being delivered in communities. Um, so there's a variety of research
Right.
to be done and participated in.
What if someone wants to participate or kind of go down this pathway,
Mm-hmm.
who are some of those people? Who who are some of the candidates for this type of pathway of getting into dental public health? Um, yeah, who should consider this pathway or this specialty?
I mean, if you are an individual that enjoys surveillance, data collection, um, who wants to understand how to use numbers to create policy or programming, I would definitely say public health dentistry is probably an area where you would have a strong interest. Um, and if you're in dental school, I know oftentimes there's usually like a health promotion or an epidemiology course, and whoever is teaching that course, I would recommend reaching out to them because they're probably very connected in terms of research. Um, yeah, I mean, I think it starts with those basic, public health courses that are offered, or community, they might call them like community oral health courses that are offered, usually in your D1 or D2 year of dental school. It starts there. And then as you decide about you're making decisions about your specialty training, um, you certainly can further that at that point.
What would you say is the most unique part about this specialty? About and even the uniqueness of being potentially double board certified in dental public health and pediatric dentistry. What's the most unique part about this focal area of this dual focal area?
Yeah, I mean, I think what's unique about it is that you're not sold to one thing, right? You're able to kind of identify what some of the challenges are in one specialty and use your background from another one to help answer some of those questions, right? So, why are our caries rates so high, among children, especially among certain populations? Um, and how are we going to create programming or policies to address that issue? I mean, a lot of it is the same thing over and over again. I mean, if you're a clinician and you see kids coming through your practice and they have these high caries rates, you have to ask yourself why that is. What are the social determinants of health that are um, barriers or limitations to completing care for this particular patient? Is it that we need to focus more on prevention? Well, it's hard to do when the patient walks in the door and they already have so much caries that prevention is, um, kind of secondary at this point, right? We have to eliminate disease and then talk about how we maintain that disease-free state, and doing that oral health education with the parent. So for me, it's not such a cut and dry question because I feel like um, there are things that kind of feed into both specialties, um, that would lend itself to want to answer some of the questions that we're asking ourselves as clinicians. What can I do to improve this patient's oral health outcome, right? But also, what can I do on a broader level from that public health perspective in order to really impact many people in the community? Um, so that I see more reductions in caries rates and things of that nature.
So true. And you mentioned social determinants of health. You mentioned caries rates, all of things that, unless you're a dentist, unfortunately, or have a lens or have a lens in healthcare
Mm,
that leads itself to some of the issues, most individuals that are making the decisions have no idea about the connections of oral health and overall health,
mm-hmm.
let alone um, how to make those changes, right?
Right.
Luckily for us in oral health, both maternal child care and even more specifically, care for children or health care for children are now at the forefront, meaning they are considered primary care. Pediatric dentistry is now fallen under primary care on the medicine side.
Mm-hmm.
General dentistry also has fallen under the moniker of primary care and medicine via the government programs and fundings and grants like HRSA, the CDC, et cetera.
Mm-hmm.
However, the challenge is that there are not a lot of individuals from oral health
Mm-hmm.
that have taken on those roles, like yourself and many others,
Mm-hmm.
to help put oral health at the at to make oral health a priority,
Right.
right? It's being known more and more as it relates to primary care, and more because it's related to um, other larger platforms and priorities like maternal child care and overall care for children through CHIP and through Medicaid and things like that.
Right.
But there's still very much a big challenge and a disconnect, which is the reason why it's so important for new dentists in training to understand the importance and have those exposures, um, because we are continuing to kind of go through the same cycle year after year, decade after decade, 50 years, 30 years, 100 years later. And yeah, some things have changed, but there's a lot that still has not changed. So that was just kind of like uh, uh, a public service announcement
Yeah.
for the
Right.
importance of the other side, not necessarily the training of the clinical skills, but
Mm-hmm.
also the advocacy.
Yeah.
Because the people that are making the decisions about oral health care
Mm-hmm.
are not necessarily the ones that have been trained in
Right.
oral health care.
Right.
So
Very true. Which is why, and I don't want to leave the impression that public health dentistry is just, kind of just about creating programs, which it is. I mean, we want more school-based programs. We want, all kinds of programming to address oral health needs in the community. But we do, there are public health dentists who just focus on policy and advocacy, and working with lawmakers to, encourage them to make those decisions that would promote oral health. Legislation, for example, I think one of the things that came up in the last couple of years is the limited amount of OR time for pediatric dentists, and the long wait time for some kids who have extensive dental disease. Some kids can be waiting up to 6 months or over a year to be seen in the OR. And that's where your public health dentists come in, right? They come in and they talk to legislators. And even pediatric dentists can do this. Also, you know, going to some of those advocacy meetings on the Hill and being a voice for oral health.
we still got a lot of work to do.
Yes, sir.
And we may even have to think differently about those approaches
Mm-hmm.
because we've been going to the Hill. We have dental associations, state dental associations that advocate for this and that.
Yeah.
But that could be a challenge. It all depends on who's supporting it.
Yeah.
money, supportive of those that are supporting it,
Yep.
which is a whole nother discussion. But
Mhm.
it's important to note because there are also individuals who probably should not consider public health dentistry. So let's
Mm.
flip it. Why should someone not choose this type of pathway?
I think, for me, that question was probably one of the easiest ones that you posed. Don't do anything you don't want to do. You're not going to be passionate about it, you know? So, I mean, for me, it's, can we focus our energies on building those students, those new dentists who are passionate about community advocacy work, and making a difference, not just on the patient level, but on the community level. So, you know, for me, I think that's just a simple question, a simple answer. Don't do anything you don't want to. You'll hate it. You'll hate it.
Yeah, and I would also add, don't consider this pathway if you're looking to get rich or if you're
No.
looking to have a salary
Right.
that's that equals what you're paying for dental school or what your
Right.
final dental school bill would be, because this ain't it, right?
No. And
Um,
to be honest, there are very few specialties that will lead you to that path these days anyway. So be sure about what it is you're choosing to do.
right,
Um,
right.
can you see yourself doing it in 10 years if it doesn't produce the revenue that you thought it was going to produce? Do you love it enough to still do it? Then I think those are the kinds of questions we should be asking or encouraging students to ask themselves while they're in dental school is, what do you see yourself doing in 10 years?
Yeah, yeah.
Yeah.
So let's go to the third quadrant of questions
Yeah.
as it relates to currently your role
Yeah.
and how your new role is related to some of the things that you have experienced professionally, so that we can get a better idea as to now where you are taking those past experiences and now moving forward, what your new charge is. So tell us a little bit about this new role that you've embarked upon, and the city of brotherly love and sisterly affection, as we call it in Jersey here, from
Right.
our Pennsylvania uh, 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 partners across the water here. What's so? Let's hear about that, and then segue into what that means as like a typical day in this new role that you have within the community in Philadelphia.
Sure. So I've recently joined Penn Dental Medicine as an assistant professor of community oral health and also an assistant professor of clinical pediatric dentistry. So I'm serving in two departments, and I'm also serving as the assistant director for the community oral health department as well. And you know, on the pediatric dentistry side, I will be supervising predoctoral students who are doing their pediatric dentistry rotation, as well as residents who are matriculating through, their residency program. Hopefully, the goal is to also get to a point where I'm mentoring some of these students with some of their research projects. Those individuals who are in the residency program. On the community oral health side, the focus is going to be really cultivating and producing more research focused, specifically on community oral health, within that Philadelphia area. I'm still learning about all the programs that they have at Penn Dental Medicine, but they have partnerships with some great organizations and students who are rotating in. I want to say there's 4 or 5 community health centers, and they're providing care. And they also have AEGD residents who are rotating through community health centers as well. And so, outside of that, there's going to be some grants management and grants development that I'll be working closely with our team on. So, we'll see. We'll see how we're able to marry the two. I know that the chair of the Pediatric Dentistry Department is excited about, the potential for more partnership with community oral health. So I think it's going to be a great marriage of two departments that rub shoulders naturally anyway. Um, and, that's kind of like my new role.
Yeah. So as you are still kind of learning more about the community, this new community that you are going to be supporting, what are you thinking will be the components of what a typical day would look like? And it may not be typical because I mean, even though it may have some typical scheduling components, 9 to 5, 8 to 4, whatever that is, but we all know that it's more than just that time period, right? There's weekend activities and everything else. So
for our students that are watching, I think what I want to do is kind of talk about what my schedule kind of looked like when I was in a federally qualified health center versus what it's going to look like now as more of an academic. So in community health center world, because I was a dental director, 50% of my time was admin and 50% was clinical. And on those days where I was clinical, it was 2 to 3 days a week. And it changed throughout the years that I was dental director. But I would have anywhere from, maybe 16 to 18 patients on the schedule a day. And, I would then, throughout the day or towards the end of the day, be responsible for, supervising students, signing off on those charts in addition to, my own patient charts. So at the end of the day, depending on, if I was precepting students who were rotating, I could have seen anywhere from, 25 to 30 patients a day. Okay. If you ask some of my colleagues who are pediatric dentists who are in private practice, they're probably seeing anywhere from 30 to 40 patients a day, including the hygiene exams they're doing on top of their clinical pediatric dentistry responsibilities, right? So now as an academic, I'm going to be in the clinic 2 days a week. So I will be, supervising pre-docs one day and then supervising the residents another, along with other faculty. They have, quite an amazing group of faculty in the pediatrics department at Penn Dental. And then on the other days, one day is set aside for teaching in community oral health and potentially in pediatric dentistry as well. And then another 2 days that are dedicated to grants management and research. And so, that's kind of how my days have kind of evolved. And obviously, with supervising patient care in pediatric dentistry, that's going to include, days where they're doing sedation or just the regular, clinic, whatever's on the schedule there. And then I'm hoping at some point to be credentialed and to be able to do some work in the OR at least maybe once a month or so. So that's how it's going to be different. I'm excited. It's more of the same, but just kind of like in a different structure, I think.
Right. Right.
So looking forward to it.
What do you foresee is going to be the toughest part in this new role, given that you've, of course, have done this before, meaning you've had other experiences that have led up to and have exposed you to what you're going to be doing at UPenn. But it's slightly, not completely different, but slightly different in the sense that you'll have the pre-docs and residents as well involved. I'm not sure. I don't remember if I heard any involvement or touch points with students or residents in the dental public health specialty program. I'm not sure. I can't remember if UPenn has
Yeah,
that
Penn does.
specialty?
Yeah, Penn. There's 16 programs. Penn doesn't have one specifically. But what they do have is they were recently funded with got HRSA funding for a AEGD program that's focused kind of on community oral health.
Mm-hmm.
So it's based in that department. And
Right.
those AEGD residents, like I was telling you about, they are rotating through those community sites that they have. I
That's
think
good.
the long-term goal is to eventually have a program there. But this is what we're focusing on building up to that with this AEGD residency.
Yeah, and I think as an aside, I think Philly is one of those cities where it can support that type of initiative, like just like Boston has, and some of those major cities that have a
Hmm.
large populace of people and a larger number of potential future docs that want to explore uh, the specialty in that way as well. So, what would you what would you say is going to be? What do you foresee is going to be the most challenging part or aspects about this role, about this position?
I mean, to be honest, for me, in any new role, it's time management, right? Because you want to be able to give 110% to whatever it is you're doing. And in my experience, there's always bleed. So even as dental director in a community-based health center, there are days where I was supposed to be in clinic. Somehow admin stuff would seep into those days. And so, my concern is protecting time that is um, designated for each department, so that they all get the attention that they each need. That's probably one of my greatest concerns. Um, but I do think that after some time, we can create a blueprint that's going to work for myself and for everyone else. Um, in terms of the work, I'm always up for a challenge, so I'm excited about the research that I might be potentially doing. And we kind of have to um, sit down and discuss the areas of focus. But definitely, I've always been interested in oral health disparities. There's a lot out there now on the social and behavioral aspects of things and how those kind of affect, our oral health outcomes as well. And so, I'm excited about the research that we're going to be potentially doing as well. But I have no doubt in my mind that that's going to be a challenge. Um, in academia, I think there's kind of like a guideline for what academics are supposed to be doing throughout the year, which includes things like teaching, service, it, and those things you kind of have to work towards. There has to be a roadmap so that you will have the ability to be promoted from like an assistant professor to an associate, and then from an associate to a professor. And so, scholarship is one of those things, and that's where research kind of falls. So I'm thinking that's probably going to be the greatest challenge, because publishing, if you've ever, I don't know if you've ever kind of been through that process. It's not something that I've done a lot of, but it can be a challenge. But from what I understand, once you get into the rhythm of it, it's reasonable for you to be able to publish at least 2 to 3 papers a year, and that would be the goal.
Yeah, that's going to be a challenge,
Yes. Yeah.
but it can be done,
It can
especially
be
if you're
done.
collaborating with others, whether it's at your institution
Yep. Or
or
other.
other
Yeah.
institutions as well,
And what's great
right?
about Penn Dental is that they have an office, I think, of global or international health. They have some great statisticians and individuals who are well versed in doing a lot of research. It just kind of hasn't come out of community or oral health.
Mhm.
And so I'll be the one hopefully partnering with some individuals in those departments to kind of get it done. So that's
As
exciting.
as you as you as you have taken on this new role at UPenn,
Hmm.
and you have had similar experiences at Tufts and BU and other institutions,
Hmm.
what would you say overall in this role, in this specialty, this unique special dual specialty that you're kind of have been navigating? What would you say is the most rewarding or has been the most rewarding part about what you do?
Yeah, I mean, the opportunity to continually learn. I mean, that's the best of it, right? So even though I've kind of been working in this sphere of pediatric dentistry and dental public health for a long, long time, you see how it's kind of evolved and changed into different things. You know, I start out as a general dentist in a community health center environment, treating patients and mostly adults and then onto families. And then that transition leads me to leadership roles and advocating for programming, implementing school-based programs and community-based health centers, you know, doing some interdisciplinary work with pediatric medicine and primary care and internal medicine and family medicine to reach our patients. Um, and just, this opportunity to kind of continue to just kind of evolve in a different arena. I mean, that's to me is its own reward. Just the opportunity to continually learn.
That's awesome. That's awesome. All right, time for some fun.
Yeah.
Some fun and learn a little bit more about you and how you tick and how you motivate yourself and things that you like. And then right after that, we will dive into a couple bonus questions. So guys, and gals who are listening and watching, hang on, it's coming. Hang on. The bonus questions and information is coming. So lifestyle, fun. So typical. How many hours do you work during the week, would you say?
Well, now probably closer to 40, 45. Before, it could be anywhere from 40 to 50. Yeah.
Hours per sleep at night, do you typically get that you try to get?
6. 6 is the goal. If we get 6, we're ahead of the game. 8 is luxury. That happens around the holidays, I guess.
Right.
But yeah, 6 is a great goal.
Morning or night person?
Definitely morning.
Morning.
Don't talk to me after 9:30. I don't know what you're talking about. Not even coherent.
You mean 9:30 at night? At
9:30 at night. I
Oh.
can't. I can't do it. What's funny? When I started dental school, I thought that I would be able to be one of those people that stayed up all night and studied.
Yeah,
That
shut
wasn't
it
me.
down.
That
Not
wasn't
at
me.
all, right?
No, I'm that person that goes to bed at 9:30 and wakes up at 2 in the morning. Yeah. Cannot do it. Seeing stars.
Favorites. Favorite color?
Orange.
Orange. Okay, interesting.
Orange. Yeah.
Favorite food and drink?
I have a sweet tooth. So
Sweet tooth.
Yeah, so pastries, cakes, all the stuff that's not good, especially.
Well, it's not good if you don't do something before and after
Right.
eating those
Right.
things, right?
Right.
Favorite place to visit or vacation, or that's on your list, on your bucket list?
Oh man, one of my favorite places, Italy. I
Italy.
can't get enough of it. Yeah, I really enjoyed visiting there. Went to Germany a couple of years ago. Really enjoyed that. I, fun fact, my dad was from the Caribbean, so there's something in me that's always gonna love a little bit of the Caribbean too. The last place that I went, I think, was Turks and Caicos. Really enjoyed that. Beautiful, beautiful country.
Right. Exactly. And last thing, favorite thing to do when you're not in the office or not in the community, advocating for health?
I mean, spending time with friends and family, right? So with work, there are people that you're made to spend time with.
Right.
And then, on your free time, they're the people that you like to spend time with, that you enjoy. So definitely spending time with my friends and family, whether that is hanging out with some museums or, going to see a show of some sort, just doing something together. Love that for me.
Well, there's lots of things to explore in Philly. Absolutely.
Yeah.
A lot of museums, shows,
concerts, all that
concerts,
stuff.
food places, right? That are popping up, restaurants.
I'm
Right?
excited. I already have a list. I already asked some key people some questions, so I'm excited.
Yeah. Yeah. All right. Bonus questions. Bonus questions. We got 3 of them. First
Sure.
one. What would you say are the things that you're constantly saying to the individuals and families that you're providing care for, as far as instructions, tips, health advice that you give to them? What's some of what's the maybe 1 or 2 things that you most commonly repetitively say to them?
Yeah. So for parents, because that's who I'm largely dealing with now, is reminding them to, because they're so consistent about making the doctor's appointments for the kids, right? Because they have immunizations and things of like that nature to keep up with, vaccinations or whatever. I'm constantly telling them, schedule your child's dental appointment at the same time that you schedule, or around the same time that you schedule their PCP appointment, because that way it won't fall under the radar, right? So that's one of the things I tell patients. They're always like, yeah, you know what, I should do that. Um,
Mm.
it's like, it's otherwise it becomes an afterthought, or it doesn't come up until their kid is like, mom and dad, my tooth hurts. So there's that. And then I also tell them, a lot of parents with regards to oral hygiene, they hear it from us all the time, right? Like, make sure your child is brushing before they go to bed at night, in the morning, and all this mundane stuff. But what I try to do is help it to be doable for them. So, flossing is one of the things that we know is going to help, reduce the likelihood of that interproximal decay. So I'm always telling parents, why are we, fighting kids in the morning when you're trying to get out the door? You do it in the evening before they're going to bed, before there's, where there's a little bit more time to focus on it. And I find that parents are usually quite appreciative of that piece of advice as well.
Well, let's also hope that they're flossing.
Yeah. Well, that's another thing about pediatric dentistry, right? Because you end up being like the person that's caring for the family, right? So that's kind of,
Yeah.
they're caring for all of their dental needs.
Yeah.
Good thing.
Okay. That was
Yeah.
good. I like that. I like that. Tips. What are 3 tips that you want to share with aspiring dentists,
Yeah.
those that are pre-dental students
Hmm.
and or students that are in school now that are still kind of navigating, um, like you did, navigating all the different disciplines and the components of dentistry overall in the profession? Um, 3 tips for those
Yeah.
aspiring
So
dentists or new dentists.
yeah. So if you're in dental school, study to understand, not just to get the grade. You will remember more. Okay. Rote memorization is something that a lot of us end up having to do. But if you really study with the intention of trying to understand, you will find that you will be able to absorb much more information. The other thing is create a blueprint for yourself in terms of your time management. For me, that was, like I said, I was not pulling all nighters, but one of the things I did do was, after going to class, I would consistently spend an hour right after class reviewing my notes. And I would do that cumulatively up until the time of the exam or next test. And I found that method helped me to be more successful than just going to class, leaving my notes, and not looking at them again until the night before the exam. That's a disaster. Um, so coming up with a plan that works for yourself, and also making sure that you get in some of that social time as well, because you can't just study all the time. Make time to have a little bit of fun in dental school as well. And then, like I said earlier, ask yourself, can I see myself doing this in 10 years? And make your decisions around that. If you're interested in specializing, I strongly advise shadowing. Shadowing is great, so you can actually see what it is you'll be getting into. So make those connections with faculty. There's a lot of faculty who are in private practice or who have a lot of connections, who can guide you. And certainly in the different departments in dental school, I'm sure that there's opportunity for shadowing as well.
Always, always.
Yeah.
If not, you create that opportunity.
Mm-hmm.
Create that opportunity. Be creative, right?
Yes. Yes.
Just because there isn't something doesn't mean that there won't be or cannot be
Mm-hmm.
an opportunity
For sure.
to shadow. Awesome. One thing,
Hmm.
one thing, if you could change the dental profession, what is one thing that you would want to change about our profession? What would that one thing be?
It's not what you think it's gonna be. I can tell you that. To be honest, right now at this stage in my career, I think that we need to improve diversity in the profession, so that it's more reflective of the general population, right? 70% of dentists are white, only 3.8% of dentists are African American, and about 6% are Hispanic, 17% are Asian. The differences with um, our African Americans is that that population is it's not growing, and so we need to look at, you know, our educational system, the applicant pool, and acceptance rate. It's just what it is.
Well, you will have many that say, yes, we do need to expand
Mm-hmm.
and continue to diversify. Uh, but we also, well, part of that also means finding out where our students or certain students are going or leaning towards and why.
Yeah,
I think that's a big piece of it,
yeah.
a big piece of it, because there are many more that are going into engineering. There are many more that are going into medicine, right?
Mm-hmm.
Not specifically the specialty of oral health care, because you guys do know that dentistry is really a specialty of medicine.
Yeah,
Uh, and if you didn't know, now you know, right?
yeah.
It really is. But
Yeah, I mean, to your point, I think it starts in undergrad, right? I mean, I don't know about you, but pre-dentistry was not a thing when I was in dental school. It was
and
pre. Yeah,
in some schools, it still is not a thing. There's
yeah,
pre-med, there's
yeah,
pre-farm,
yeah,
right? It's
yeah. So
so,
my guess is that we there's more work to be done at the undergraduate level as well.
and some would say much earlier than that, right?
High
High
school.
school,
Mm-hmm.
middle school,
Yeah.
elementary school,
Yep.
and then I think what's been a challenge also is the fact that um, people want a return on their investment,
Mm-hmm.
and the investment right now for dental school is all the way out to Pluto.
Yeah.
It's
It's
there's a
expensive.
big gap between dental school and some of the other
Mm-hmm.
pre-professional tracks, to the point where um, individuals may not want to invest all that time and money into
Right.
oral health, or
Well, I
they
think
see
we have to
something
make it.
comparable.
Yeah, we have to make it doable too, right? I mean, that's why it's great to have, these different grants like through HRSA, that will help in some instances pay for dental school, you know. So it's all these things.
Yeah,
There's a lot of work cut out for us.
yeah, it's a lot of work, and part of that work also is dependent on the schools.
Mm-hmm.
Even though there's a somewhat of a DEI statement in the accreditation standards, it's all left to the schools to determine how they demonstrate
Yeah.
compliance to that standard.
Mm-hmm. Mm-hmm.
And it all depends on who is the dean at the time, because the dean of the school will drive certain initiatives, especially those that are related to diversity, not only in the student population, but also in the faculty population. And it can't be, well, we don't have any students that want to go here, or we can't find any
Right.
faculty members that want, individuals that want to be faculty members at this institution because of A, B, and C.
Yeah.
Um,
Well,
off
that's
to off.
well, I was gonna say that's one of the reasons why I really, really loved, what Penn is doing, because I don't how many schools do you know really have pipelines into HBCUs? I mean, that's and I'm
I can name a couple.
we have to start somewhere,
Yeah,
right?
yeah, yeah, yeah. I mean, there are a couple.
Yeah.
Um,
I
but
mean, a
like you said,
handful out of the
yeah.
200 dental schools or so that exist. I don't know how many there are. You know what I mean? If it's like
It
five,
seems like it's
great.
200, right? Every other year, there's
136.
a
I
new
don't know.
school.
However many there are.
Almost
But it's
70, almost 70.
whatever. It's like
Yeah.
so.
But again, to both of our points of this discussion of the number one thing that you would change about the dental profession, which is diversity in those that are being trained and that are out in the communities practicing dentistry or delivering oral health care for individuals. That initiative also has to be embedded as a priority for dental schools.
Yeah.
And they have to, like, it has to be one of those mandated type of programs that schools are being held accountable for.
Yeah.
That's very key, because the way that schools will move on that initiative will determine chipping away and adding to that percentage of individuals from different types of backgrounds,
Right.
right? So very important. And you have to look at the social determinants of healthcare professionals, right? And one of those things is cost.
Yeah.
Cost, and that's the thing that a lot of students that you will see even at Penn say, hey, I'm thinking about this specialty. I'm thinking about ortho or endo versus pediatrics or dental public health, because I need X, Y, and Z. I want X,
Right. Well,
A,
I
B,
mean,
C.
I think one of the things, and I didn't mention this, but I think one of the things that is fair game to mention so that students are aware is that there are different programs depending on the school that you go to. So I was lucky enough to go to Boston University for my residency, and it was completely paid for through HRSA because of a program that they had, a grant that they had received at that time.
Right,
So there is there are options, right? But
right,
we kind of have to
right.
do the research ourselves, talk to faculty, and find out what's out there.
Great point. And part of you all doing the research is listening and watching these types of episodes where you can do some networking, you can do some research, you can connect the dots and connect with individuals like Dr. Powell, and people that she knows, that she networks with, right?
Mm-hmm.
It's not, the most important thing is not what you know, but who you know and who they know.
Mm-hmm.
The program at the BU is one of a very few throughout the country that have this
Yeah.
dual journey through pediatric dentistry and also dental public health. And there's some other ones throughout the country that are not necessarily aligned with or the same as her dual program,
Mm-hmm.
um, but they are out there. So part of this process for you all to understand and get a better idea as to what opportunities are within our profession and what's needed
Mm-hmm.
within the profession all stems from you being out there, reaching out and jumping into being comfortable with networking and meeting people. And that means you got to do it outside of your school too. It means you got to go
Yeah.
to SNDA conventions, uh, uh, ASDA conventions, go to meetings in the local societies where your school is or where you're from, to
Right.
network and talk to people, because it's the people that have that are the resource, right? And not everyone at the dental school will have all the information that you will need,
Mm-hmm.
right? Regardless of the fact that you're paying for that information, but not everyone's going to have all the information that you need. So you must take it upon yourself to continue to explore outside of those traditional methods. And that's why we're glad that you all listened up today on this episode. Doc, what's the best way for people to get in contact with you if they have some additional questions or just want to network with you and talk with you some more?
Sure. They can reach me on elizabethpowellbds@gmail.com. Just my name, no periods, just all one thing. elizabethpowellbds@gmail.com.
There you go.
Please
There you
reach
go.
out.
Please reach out. Please reach out. And for those of you that are thinking about dental school, and maybe want to come to the Northeast, or you're from the tri-state area, or not so far away, Maryland, Virginia, Pennsylvania, of course, maybe consider UPenn as one of those places.
Maybe.
You've got some connections now that Dr. Powell is there, and I'm sure one of her unwritten roles and duties and responsibility is also helping individuals as they make those decisions and coming and selecting and choosing lists of dental schools that they may want to matriculate at. So reach out to Dr. Powell that way. Well, Doc, thanks so much.
Thank you.
Congratulations on your new role. UPenn is very lucky to have you on board, and continued success with you all, with you there. And for everyone else that's listening, hey, if you guys found this episode very helpful, please put a yes in the chat, and also share and comment as well. Share this with someone that you think may have some use of it, and also may find it useful as well. And go to the next video. Go to the next video. Go.